Hey everyone, my name is Raquel Forrest-Grin. You know me by now if you're watching my YouTube channel, but I'm here with one of my best friends, Emily, and she's a beauty advisor. And I asked Emily to join me today. We're actually filming from New Buffalo. She lives in Kalamazoo, Michigan, and I'm in Chicago, and we met halfway because I'm working with so many of you that have talked to me about skincare, that are going through treatment or your post-treatment, and you've asked me about it because you know my skincare routine and we've gotten to know each other. And so she's an expert in this field, and she works for a company that's called Unique, and they make an incredible skincare line. They make cosmetics that are very applicable and appropriate for people that are on a journey such as yourselves. And so I wanted to have her join me because this is her gig, this is her expertise. And so I wanted to have her talk a little bit today about skincare and the importance of that and how it can help you, and just a few tips on how to help yourself feel a little bit more beauty on the outside when we know how you're feeling on the inside. And I just want to give a little bit of a shout out to a woman that I was working with at one of the hospitals in Chicago that inspired me to create this. Was about 4 days post-transplant. She had a type of aggressive leukemia and early 60s. And I walked into her room to work with her one day, and she was glowing. And her skin was dewy, and she was completely bald, and she had a really nice popping lipstick. She'd done her eyebrows, and she, of course, didn't have any eyelashes, so she didn't have mascara on or anything. But I just said to her, "You look amazing." And I knew what she'd been through because she'd been at the hospital for many, many weeks. And she said she fakes it till she makes it. She just wanted to feel beautiful on the outside. She was a beautiful, incredible woman on the inside. But sometimes we have to help ourselves get there. And so that's really, Emily, where you come in. So I'm going to turn it over to her, but let's start with skincare. So talk about the importance of starting with the basics and why skincare matters.
Okay, so now is the time in your life where your skincare is going to be more important than any other time because you have so many changes going on. So most likely whatever you were using like pre-treatment before you started radiation or chemo probably isn't going to work anymore. One of the things I highly recommend to anybody that I've talked to that has needed some advice and some help is to really invest in some better quality products and some cleaner products. So if you use something that follows the EU standards and the EU guidelines, that's the European Union, they ban 1,300 harmful chemicals.
Wow, that's unreal.
Where the US only bans 11, unfortunately. So you definitely want to kind of pick something that's going to be more EU based, that's going to be a lot cleaner for you. And then also stay away from just some of the really harsh things that are in there. Like this is now not the time for retinols, the acids, hyaluronic glycolic, different things like that. We'll get to your no wrinkles after treatment, but now is the time to really condition and moisturize and hydrate that skin. A lot of times you're going to be getting like some burns and different texture issues, some redness and things like that. So one of the important things to do is cleanse your face with something that's extremely gentle on the skin, something that rinses off very easily. So usually a cleanser that's going to be like more white based. Stay away from like a lot of like the gel base that kind of look like hand soap. Stay away from anything that has sulfates in it, which is going to be really harsh and drying on the skin as well. Something that's going to be more moisturizing. And then one of my favorite products is using an alcohol-free toner, and I love rose water. It's natural.
Do you have that one?
I do, yes.
Let me show it. Because this is literally my very, very favorite toner. I use a lot of Unique products, but this one is my favorite, and I use it when I fly. I use it when I'm working in the hospital and I'm just feeling the dry air and everything, just as like, you don't want to spray it in your mouth. But
tastes like roses.
But it tastes and smells like roses.
It does.
But it is an incredible product. So yeah, I love that one.
Not only is this going to tone your skin, it locks in the hydration into your skin. It's also going to help with some of the redness that you're going to have, some of the irritation, and it helps with sensitivity too. This is like a multi-use product, great for sunburns, so radiation burns and things like that. It's a great addition to use after your cleanser and before your moisturizer. Moisturizing is probably going to be the most important step that you can do right now, and especially a night cream because that's going to be more treatment based. and it's going to be something that's really going to condition, because your skin when you're sleeping is when you're going to get absorb the most like nutrients. So you're going to want to do something that's super antioxidant and vitamin enriched, like a lot of like niacinamides, B12s, vitamin E's, different things like that in your night cream. That is going to be probably the best thing you can do.
Could someone use a night cream? You know, I work with a lot of people that are in the hospital full time.
Yeah.
And obviously they're kind of sleeping through the day. Could someone use a night cream just the whole time?
You could. So a lot of times I'll tell people to use, like, skip a day cream or a moisturizer and just use a night cream all the time, because you're going to need something that's maybe like a little creamier, a little heavier based.
Okay.
So you can use it all the time, but you're going to get your best benefit when you're sleeping and wearing it. You're not going to have all the environmental factors that are going on during the day, like all of that screen time. Everything that is in our technological lives these days isn't good for our skin. So you're going to get the best benefit when you're actually at rest, sleeping, whenever you sleep.
Cool. All right, awesome. I think that's great. Let's stop. Let's go on to, okay, so we've washed, we've cleansed, we've moisturized, we've done our rose water. So can we talk about what would be a basic, nice, easy thing that we could do just to give the skin a little bit of color? And maybe, you know, we have a lot of uneven skin tones once we're going through treatment.
Yes.
Darker shades of gray even on the face. What can we do with foundation or coverage? What would you recommend?
Yeah, definitely. So, you know, a lot of times you get that mood skin, or you get a lot of discoloration, as she was saying, some hyperpigmentation, some burning, some redness. So it can be extremely hard to actually color match your skin when you're going through treatment and afterwards. The best thing you can do is actually kind of take the under eye skin where the cheek and the under eye area meet, because that's where you're gonna have your lightest skin and your darkest skin, and kind of find a shade that matches both of those, or blends with both of those, because then you're gonna kind of get a better match for your whole entire face. And most importantly, now is the time for more hydration, so you're gonna wanna stick to more cream-based.
Like, what about that BB cream?
Yes.
The one.
Yep. So BB cream is one of my all-time favorite products. It's light, it's dewy, it's refreshing, it's hydrating, and it's super easy. It's almost like putting on a tinted moisturizer, but it's going to even out your skin tone, which you kind of are going to need at this time.
And it feels really good on your skin. I've used this product before, particularly again when I fly, because that's when, you know, my skin is the driest. It just feels like you've got almost like a healthy mask on your face. I mean, it's so emollient. I love this one too. Is there a particular color? Like, how do you match that? Is that based on that cheek area as well?
There is. BB cream comes in all different shades, which is something that I love to kind of custom help people with, so that to make sure that you are getting, even if I do them virtually, I can match those for you. BB cream is a little bit more forgiving than like a foundation though. So even if it's not an absolute perfect, it blends really well, which is nice.
Would you use a concealer at all in this situation, or would you not, or kind of what would you do?
Like, every person is going to need something a little bit different. So if you're having like a lot of redness or burning, hyperpigmentation from sun or something, especially if it's like with skin cancer, you probably are going to want a little bit more of a concealer. So important is to pick something that's going to be really creamy and also very highly pigmented. So that is going to mean you're going to just need a little bit of product that's going to go a long way. So you have to use less product. You don't want to use something that's going to be thinner, you know, where you have to use a lot of product and then you're building and building, and it's going to start looking crepey, get into the fine lines, or getting into the different texture that you may have with like the burns and things like that.
And so after she did my foundation, she put a little bit of concealer on, because you put it on after you put it on after your foundation.
There's no rhyme or reason. 50% of us will tell you one way. And, you know, 50%. Yeah.
Okay, cool. And then so just a couple more things on it. So what about, like, what would you do next? So you've done foundation and stuff like that. What about bronzers and things like that?
Yeah.
Like to add a little bit of
course, yes. So like a little bit of swirl of blush on the cheeks can lift your cheekbones and your spirits, and it's going to add a little bit of dimension back into the face there. So just a real quick tip is, when you're putting on your blush, smile real big, like a big cheesy smile, and then you'll see the apples right here. You're going to stay 2 finger lengths away, and you're going to apply the blush right here, and you're going to actually dust it up to the hairline. So if you don't have hair, just kind of go up to the top of the ear right there. So you're going to go right on the cheek like this, dust it here, and then sweep it up to the top of the ear right there.
And they only go to right there?
Yep. And then a lot of times you're going to want to add a little bit more dimension. You might have some swelling, or you might be really gaunt and losing weight during treatment and things like that. So when you put the foundation or your BB cream or whatever on, you're kind of making it a blank canvas, and you're taking away some of that natural dimension that we have in the face. So it's nice to kind of take like a little bit of bronzer, just do the old makeup face like that, and find where those cheekbones are, and you're going to go about halfway here because you don't want to have kind of like that dirty mouth look, and you're going to go here and you're going to brush up. Same thing, we're going to go to the top of the ear or the hairline if you still have hair. So you're going to go right there, and then you're just going to add in some bronzer on that area there. It's going to just really make those cheekbones, it's going to give a little just life and youth back into the face there. It makes it look healthier.
Well, and one thing I was thinking of, there's a few of you that I work with that wear wigs, and one of the things Emily's taught me, so let's just say that you've got the wig on, you want to bring the bronzer up toward the hairline if you've got a wig on, right? To kind of like blend that a little bit. And some of you that I work with, you know that I wear a wig for you periodically. So that's a trick I need to remember to do for myself, is blend the bronzer up, because it kind of helps blend the wig a little bit more.
Yes.
Cool. All right, so just a couple more things. So what about anything with the eyes? You know, what in the world would you do if you don't have eyelashes, you don't have eyebrows?
Yeah.
How do you make any of this maybe
So one of the
well?
best things about your eyes is there's nothing that's going to happen to your actual eye, your eye color itself. So picking out your eyes, say they're blue, you want to find something on the opposite of the color wheel, because that is going to make your eyes stand out more. So the opposite of blue is going to be your purples, your oranges, your golds, things like that. If you just Google the color wheel, you can find that stuff. You know, browns are going to be really good with blues, purples, pinks. You know, greens and things like that are going to look, purple and pink are pretty universal, but a lot of people want to kind of just do browns and like beiges all the time, and that's not necessarily like the best for brown eyes. So find something that's really going to make your eyes smile and shine and bright. And then, you know, a really quick something that I like is cream shadow. You can put it on with like a little light touch of a ring finger like that.
Let's show yours.
Yes.
It's so nice. It's so creamy. Like, I actually prefer cream shadow even just being older now, because it doesn't settle in the
fine lines as much. It's almost like it has like a built-in primer with it. But you just put it on, and it does dry to a little bit of a matte, but it's just very lightweight. Dries, has kind of like a primer right in it. And it's very simple, just something that you could put on, you know, just with like your fingertip there. So that's something easy. And then probably what is going to take a little bit of technique is getting down your brows again, because the brows, they define and shape the face, and you may have lost them. So just a couple easy landmarks to go by when you're doing your brows is...
These are great tips, by the way.
Thank you, thank you. So you are gonna not go on the inside of the nose, but the actual kind of crease on the nose. So on me, it's like here. On Raquel's, hers is super defined and easy. So that is gonna be the area there. And then what I like to do is you can either take like a liner shader brush with some brow powder, or you can take a pencil, and you're just gonna go right there and kind of mark off where the beginning of the brow should be. And then you are gonna go right at the corner of your nose and the corner of your eye right there, and then find where the end of the brow should be. And then for the arch of the eye, you are gonna go right through the center, so through like the black pupil part. You're gonna go right from the corner to the black pupil right here, and find where the arch would be.
That is such a great tip, because you're right. If you don't have any eyebrows there, like, how do you even know where to start to put the eyebrow on?
Exactly.
Okay.
So I kind of like going with those 3 points, and for me it's just easiest to, you can do it with a powder, but it's easiest to do it with a pencil. And then what you're going to remember is towards the inside, the strokes kind of just go straight upwards. So the hair grows up towards the inside, and then they start to kind of curve just as your face does. So you're going to kind of do light feathery strokes. So nothing heavy, nothing too dark, light feathery strokes until about the arch. And then when you get to that arch point is when they start to kind of brush downwards. Same with your face. So it just kind of follows the natural. And if you hold on to the end of it, that's kind of a tip, because you're going to hold it a lot lighter. If you hold on up here, you're more likely to go a little bit heavy-handed there. And then just kind of lightly brush down until you get to that end there. And then what you do is take a spoolie brush, which is going to be kind of like what a mascara wand looks like, and then you're just going to brush through it, because that is what's going to just soften it and make it look more natural there.
And you know, the one thing, and this isn't necessarily meant to be a unique product video, but it kind of is, because I just like the product so much. Can you hand me that the brow palette?
Oh gosh, yes.
Because this particular palette, what I have liked about it, because you can tell I don't really have a lot of eyebrows. has a little bit of a gel, this one. And what's nice is I feel like that kind of sets it a little bit, so that, you know, during treatments or whatever, it's going to stay on, especially if you don't have any eyebrows there. I think it's going to help set it. So I just wanted to mention that.
Yeah, definitely.
And then the last thing I wanted to have you talk about are lips.
Oh yeah.
Because the lips get super dry. So many of you that I work with have mucositis, which we'll talk about a vitamin E trick. Emily is also a dental hygienist. And so she's got a lot of tips for dealing with mucositis, which I know is a huge problem for so many of you. So how do I pick a lip product? I mean, so many you see the long lasting, there's like so many choices, but how do I pick one if my lips are dry and chapped and broken?
Exactly. So typically everyone wants these long lasting lips. Unfortunately, those products are usually a little bit more drying. So those are going to be more of your liquid lipsticks that are really trendy, your stains and things like that. But those are going to be a little bit more dry, so now is not the time for that. You're going to want to pick more of a cream-based lipstick, so a really creamy, rich one, or even just like a lip gloss, and just have to reapply it possibly.
Like you can see how much, this is one of the unique lip glosses. You can see how emollient it is. It's got a little bit of a hint of shine. Which one is that one?
This one is just kind of like a nude color right here. It's actually called Luxe, and we both have it on, and it's just kind of like a nudish mauve. So like a nice tip is just pick a color that's maybe a little bit darker than your natural lip color, because it's going to add a little something special. It's going to add a little bit of hydration, and just, you know, make it more than your you know, look that you had before. So it's not about looking like Cindy Crawford. It's about looking like who you were when you were healthy before you started treatment.
Yeah, and like I said, my little lady that I walked in, she had this real rose-colored, poppy, reddish color, just boom.
Yeah.
And it just brightened up her whole face. So
look good, feel good.
Yeah, exactly. I love that. Thank you so much for taking the time. She drove all the way to New Buffalo today to help me make this video for you guys. So I hope you find it helpful. Please reach out to me.
Mouth?
Oh, I do. I don't want to forget. I don't want to forget that. But I'll finish what I'm saying here. But please reach out to me if you want to get Emily's contact information. She customizes everything for you. So don't hesitate to do that. I think that you'd be really pleased with once you just kind of tried that and see how you feel on mucositis and vitamin E. That'll be our last tip for the time. So with that, what you were telling me about vitamin E and what to do with that. So can you describe it?
Yes. So I've been a hygienist for 16 years and have had numerous amounts of patients that have had cancer treatments, and especially with radiation, you get a lot more of the drying and the chemotherapy and things like that. A lot of people tend to get something called mucositis. So that is going to be an inflammation and a sore inside of their mouth, where it is so painful sometimes, as you guys may know, that it's hard to eat. It's hard to keep weight on, which is so important when you're going through treatment and chemo and things like that. So what you can do is take those, just your little generic vitamin E pills that you can get from Target or whatever, crack them open, and it's like a serum inside, and actually take that vitamin E and rub it right on those sores that you have inside your mouth, or even if you have them like in the corners of your mouth or on the outside. And this works great on the skin too. If you're having treatment other places, a lot of times you're going to get radiation in the lymph node areas and things like that, so you might have some burning here. It helps, but it's really, really good for your mouth and helps you.
Oh, such a great tip. I'm so glad to have that tip, because I can think of 2 people right now that I know really need that. So
yeah, and then just as a hygienist, I have to tell you, if you didn't know already from your dentist, you need to be on a prescription strength fluoride treatment. A rinse, a toothpaste, there's spritz, all different things. Probably the best line out there you can actually get without even going to your dentist. It's called Cari Free, CARI free.com. Has all sorts of products, but those also not only have prescription strength fluoride, they have acid reducers and things like that, and where they decrease the amount of acid, so the pH is at a more healthy level.
That's amazing.
So they're not spreading bacteria, because a lot of people have a problem with getting a lot of rampant decay during treatment because the mouth is so dry they don't have that natural saliva cleanser anymore.
Makes total sense.
Yeah.
Thank you so much. Thanks for joining. And again, have questions or want to contact and reach out, get in touch with Emily, reach out to me and I'll connect you.
Thank you.
Thanks, guys.